Hello everybody, and it's good to be talking to you all again. This video is going to be a little bit shorter, and I'm going to start to try to get into a little bit what I've been alluding to since I started re-uploading videos, and that's the mind-body medicine. And now some people might be trying to say, well, what does that mean? Because isn't meditation mind-body medicine? And sure, that's all true. What I mean to talk about is the work of, a number of doctors, you can't name them all, and therapists as well, and other people who've done great work in this area, but about using the mind to help with chronic pain conditions that previously were considered to have a no known cause and to be incurable. So the first person I ever heard that really made me think about this deeply was Dr. Howard Scheubiner out of Michigan. He has a mind-body clinic, and he's a professor at a medical institution out there, is my understanding. He's on faculty, and he was trained by somebody named John Sarno to a certain extent. Prior to that, I believe he had been doing mindfulness-based stress reduction, and I believe he did his training under John Kabat-Zinn. Please correct me if I'm wrong, but that's what I believe I heard him say. So I'm really going to talk for a few minutes here, but I'm really more important things is I'm going to be posting, I believe, on the YouTube screen. These things called cards will come up on the upper right-hand corner of the screen. And also down in the description I'll put links to a few things. So I'll explain what those are in a minute. But I heard a lecture by Howard Scheubiner on a Grand Rounds that was on a disc of educational CDs that I had, where he was talking about mind-body syndrome, which now they often refer to as psychophysiologic disorder, or PPD. When they do mind-body syndrome, it might be MBS. There is a very large group of conditions that fall under these. And unfortunately, a lot of these are things that in medicine we try to treat with surgeries and medications, when really the treatment is more of a psychological approach. So to give a short list of some things would be chronic back pain. Very often is a psychophysiologic disorder. Talk more about that in a second. Fibromyalgia, irritable bowel syndrome, chronic fatigue syndrome, chronic migraines, chronic tension headaches, tinnitus or ringing in the ears. These are just to name a few. There are actually many more. Anxiety, depression, post-traumatic stress disorder. All things that unfortunately in the medical field, we've over-medicalized, and sometimes the patients have not had the best result. Now, this is definitely not to bash the medical field, because the medical field plays an important role in this process. It is extremely important that we do rule out conditions that need to be treated with medication, surgery, chemotherapy, whatever. So we are not talking about pain from tumors, fractures, or inflammatory disorders such as rheumatoid arthritis, lupus, these kind of things, okay? We're not talking about these. We're talking about conditions where, as medical doctors, we can do many tests. We do not find a problem in the body. We do not find the answer to the problem in the laboratory work. We have medically ruled out physical disease. Now, with that said, psychophysiologic disorder is a real condition where people have real objective symptoms and they suffer from those symptoms. This is not saying that these problems are in one's mind. And just to put this out there, I have suffered from a number of psychophysiologic disorders and mind-body syndromes, including chronic migraines, chronic tension headaches, anxiety, panic, depression, okay? So this is something that actually probably most people have had at one point or another. And that is, a physical condition, sensation, or even psychological, such as depression or anxiety, that was really brought on by a process, what they call neuropathways in the brain. There will be a short 3-minute video that I place a card as well as a link in the description that describes chronic pain and neuropathways. It's a very great description and cartoon that really drives the point home. And then I'm going to put a 22-minute video as a lecture as a TED-style, TED-like talk by Dr. Howard Scheubiner that I believe he gave in Michigan. And he'll give about 22-minute talk on mind-body syndrome, psychophysiologic disorder, and some of the patients and cases he's treated over the years. So, what I would just say quickly about that is that essentially what happens in these conditions is that our bodies, our brains have learned to make us feel pain. And essentially, when you delve in enough, you know that all pains in the brain, even acute pain, as if I stub my toe, my brain is what is telling me what I'm feeling, how intense it should be, and what I'm feeling. So, unfortunately, what can happen, either with a traumatic injury can kick it off, or even without an injury, you can develop these syndromes. The brain tells you you are having a symptom somewhere. And it can become a learned thing that your brain gets really good at. Just as we learn how to walk as children, and when you're walking down the street, you don't tell yourself, lift the foot, move the foot, drop the foot, bring the other one up. You just do it without thinking, because that's a neural pathway that is developed. Well, pain can be the same thing. Your brain can be telling your back that it hurts. You can be feeling pain in your back, but there's no condition in the back that is actually causing that pain. And this, just to clarify something about back pain really quickly, is if you do MRI scans of large numbers of people who don't have pain, you will see bulging disc, degenerative disc disease, stenosis, all these things. So one might be saying, well, my doctor did an MRI and I have all these problems with my back. And that may be contributing to pain. However, most often it's not. There's no correlation between MRI results and pain in patients, because if 50% of healthy 20-year-olds without pain will have these findings, positive findings, of disc problems and disc degeneration and these kind of things on their MRIs. I'll post the exact correct numbers below. It might not be exactly accurate, and it'll also be in some of the lecture that Dr. Scheubiner gives. But long story short, we convince ourselves that there's something broken in our bodies, and that unfortunately actually leads to us being unable to get better from these conditions. When I was in medical school, I learned from pain specialists and from primary care doctors that I trained under, who were very good, well-meaning people, but unfortunately we learned that tell these chronic pain patients that they will always be in pain. We're probably not going to take away their pain, but that maybe with medications and physical therapy we can manage their pain. And I believed that because that's what I was told. I no longer believe that, and now I cringe to think that a patient's being told that, because if you tell somebody they're going to be in pain the rest of their life, that can strengthen that pathway. That could become a self-fulfilling prophecy. And this is not woo-woo, foo-foo. There are thousands of patients, hundreds of patients at least, have been treated and helped with a mind-body approach. I'll also put this was from the 90s, and that 2020 segment by John Stotzel, when he actually did a segment on Dr. John Sarno, who was a doc out in New York, who basically realized and came to the conclusion that these patients' pain had nothing to do with what we were seeing on their x-rays and MRIs, because when you do the exam and take the history, it just doesn't make sense. And so watch these videos. They will get more into what causes these syndromes, and then a little bit more into the treatment. Not too deep, but give them a chance. Watch them. It might really make you think about this. I was very interested in this stuff, and then once I did an actual 2.5 day training with Howard Scheubiner and Alan Gordon, who's the therapist who's running, I believe, the research study down in Boulder, where they're having amazing results. The trial's still going on, and they're trying to increase the trial size. It was life-changing. The lectures, and I delved more and I learned more, but then we actually had a lecture at night that we weren't even supposed to go to that was open to other people on campus, and a woman came in from another group, and Alan worked with her on her post-herpetic neuralgia pain that she had had for 12 years, and in that short meeting was able to seem to help her relieve that pain, at least temporarily, showing that she could probably end up curing it and relieving it long term. And so I am definitely a believer, and I'm looking forward to doing this kind of work with patients and spreading this. So once again, I've talked longer than I meant to, but this is really interesting stuff. So much better than what I've just said. Watch these 3 videos. I'm going to put cards up, and I'm going to put links in the description. And please write back comments. Tell me what you think. And if you have chronic pain, watch these and see what you think about this stuff. Once again, thank you so much. And I look forward to seeing you all next time. Bye.